Thank you, Rick, for that wonderful introduction. I just want to also tell you a little bit more about my background. You can see I have a master's in public policy, which means that I'm actually very concerned with the politics and policy of all of these things and of healthcare reform in general, which is why I've been focusing my work on who's left out of healthcare reform, the implementation of it, and all of the different decisions that go into all of those things. So today we're going to focus really just on immigrant children, and not so much on the politics of healthcare reform, but I do want you to keep in mind as we go through this presentation that all of these decisions are politically based and aren't necessarily the policy decision that we want to go with. So moving on, let's just start with a big picture kind of way for those of you who aren't familiar with the health insurance system in California. And here we have, this is the current population survey data for the nation. So we're going to start really big picture with the United States, and you can see that the uninsured is 50 million people uninsured in the United States as of 2009. Now 2010 is actually available, and that number did go up slightly for 2010, but I use 2009 here because later when we use our California Health Interview Survey and really talk about the impact of immigrant children being left out in California, we use 2009 data. So I wanted to show you the comparable national level data here. So you have 50 million uninsured, and you can see that's nearly 20%, 18.8%. And then we have the private insurance system and the public insurance system. Now, for those of you who are math inclined, you can see that these add up to more than 100%. And here, you can tell that this and this by themselves are 85% of the population, and that's over 100. Well, this actually stands alone. That's a residual. So the uninsured in this survey are people that didn't have any kind of coverage. But it is possible to have more than one type of coverage. So the different types of private are job-based and then non-group, which is kind of the wonky term for individually purchased. These are the people who go themselves, instead of getting their coverage to their job, they call up Kaiser, they call up Blue Shield, and they buy it themselves. So that's what non-group means. It could be a family. So even though it says non-group, what we're talking about here is a large group of employees. We're not talking about that's just one person. It could be a person and their family, but they're still all considered individually. And then we have the public system, Medicaid, Medicare, and then they pulled out military here, the people at the University of Minnesota who put this together, where I got this data from. You can also have other public kinds of coverage, like small programs. We have AIM, and then there's also the CHIP program nationally, so those would be included in there as well. But it is possible, and quite a few people have this, let's say Medicare and job-based coverage, because most people don't have Medicare by themselves. Now, a lot of people look at this number and say, why is Medicare so small here? Well, it's because we're only looking at ages 0 to 64. Medicare is really a program for people 65 and over, and when we talk about the uninsured, we only talk about 0 to 64 because people 65 and over, nearly 100% of them have Medicare. But there is some small population of non-elderly who also have Medicare, and those are people who are disabled, or maybe the children of people on Medicare who are disabled might be included in here too. So here you can see Medicaid is at 44 million, and when you look at over 65, it ends up being about 48. I want to point out also that Medicare is actually smaller than that. It's about 45. And most people don't know that Medicaid nationally is actually a bigger program than Medicare. So that's the national picture, and if anyone has any questions, you can feel free to stop me if we'd like to, as we go through. And then let's look at how California compares to the rest of the country. So here we're looking at ages 0 to 18. So it's just children, and I'd like to point out that this is from the Kaiser Family Foundation, statehealthfacts.org, where you get these lovely maps. And you can see the range here starts at 3% for kids. So when you have this lowest uninsured rate in the country for children, it's at 3%, and the highest is at 18%. As you get darker, it gets higher, and California is among the darker states. Now we have some of the highest uninsured rates for children in the country, and we also are in the company of Arizona, New Mexico, Texas, Florida, and some of these other states. These are also high immigration rate states. So there is some tie there in terms of whether or not children can get health insurance coverage because of these restrictions. And then when we look at adults, the pattern looks pretty similar. You can see California here is again darker, along with a lot of those same states. But I do want to point out the range is higher. It starts at 7% right here for adults, which you get up in the Northeast in those states, and it goes all the way up to 33%. So there are some states, ours included, where 1/4 to 1/3 of adults are uninsured. And a big reason for that is that public coverage does not have the same, it's called generosity, eligibility levels as you get for kids. So when you have job-based coverage, it's just based on your job, and then a lot of times the employee is in, but the kids might be left out because it costs a little bit more for dependent coverage. That happens quite often. We have to pay more for that. In public coverage, it's reversed. The kids actually have more ability to get public coverage. Medicaid is more generous for children than for their parents. And if you don't have kids, you're pretty much locked out of public coverage entirely. So that's the current system that we have now in 2009. So now let's move just to looking at California. And this is data from our California Health Interview Survey for 2009. Hopefully it's clearer in the handouts on the screen. On here, it's a little bit hard to see, especially with this black on burgundy here. But so you can see that still 52% of people have job-based coverage, and that's 17 million people in California. But the uninsured number has already topped 7 million, and it's over 1/5 of the state. And that is the highest rate. In 2007, it was at 6.4 million. So just from 07 to 09, we have this humongous jump from 6.4 to about 7.1 million. And that is entirely due to the fact that this went down by about 3 to 4 percentage points, around there, about 3.5. And of course, we all know what happened with that. The Great Recession that started in fall of 2008 really hit job-based coverage hard. There was that subsidy, the COBRA subsidy, that paid for health insurance for people, but they paid 2/3 of the cost of COBRA, but still that was unaffordable for a lot of people, and so they just became uninsured. But Medi-Cal and Healthy Families here, the two programs, and Medi-Cal is our name for Medicaid in California, and Healthy Families is our name for our CHIP program in California. That did grow. It went up to, right now it's just over 5 million, at 5.3 million people, and it's about 16%. That grew by a couple percentage points, but it just couldn't absorb all of it, which is why you have this big jump in the uninsured. So I want to remind people tend to forget how bad it got, how quickly. I mean, in 2007, the unemployment rate in California was 5.4%. 5.4%. By 2009, and actually it was kind of by the early 2009, it was already at 12.3%. More than doubled in a very short period of time. And we've been stuck around 12% since then. Sometimes it's crept back down to 11.9, and still it's at 12.2%. And it's just been hanging out around 12%. So there's really no reason to think that this has gotten any better. And the job-based coverage is really stretched to its maximum here. And then the other two groups I want to point out, individually purchased, which is that non-group that we talked about before, and you can see it's only 6%. In healthcare reform, there's a lot of action about exchanges and getting more people to buy their own insurance coverage, but right now it's only 6%. And the big reason for that is because it's very, very, very expensive if they even decide that they're going to give you coverage. And those two things make it so that most people just can't do it. And then here we have this other population, and again, that's going to be public programs like AIM, some of those people on Medicare who are under 64, just those other groups. Okay. So now within California, we do have variation in the uninsured. California is not a uniform state. We are the size of a country. In fact, we're bigger than many countries around the world. So California has a county-level system, especially public coverage, where most of the Medicaid and Healthy Families programs are organized at the county level in terms of enrolling people and getting them in coverage. And then there was also different county rates of unemployment. We have some counties like Marin up here, which you can see is very light, which means it's in this 9.8 to 17% uninsured band, which only had still, even in 2009, a 9% unemployment rate. So their unemployment rate went up. It wasn't good, but it was lower than the others. And then you get over here to San Bernardino and Riverside, where the unemployment rate is actually closer to 20% or so. So Unemployment also varied across the state. So you can see here that these darker areas here are where we have high rates of uninsurance. So that's what we're seeing on this map. It goes all the way up to 23 to 29, 30%. And it's concentrated here in these kind of Central Valley and Los Angeles County. Los Angeles County does not have the highest rate. It's in the low 20s, and these are higher. But it actually has the most uninsured people. We call it the epicenter of uninsurance in California. And it's been that way for quite some time now. For the decade that we've been doing these surveys, Los Angeles has a little over 2 million uninsured people just in Los Angeles County. And again, remember, it's 7 million statewide. Okay, so let's just look a little bit at who the uninsured are in terms of their household income. Because many people say, well, if they're uninsured, why can't they just go out and buy coverage? Biggest reason is cost. You have 2.3 million people who are uninsured who are living at under 100% of the federal poverty level. Now, for those of you who might not know, the federal poverty level is how the federal government says this is what we define as poor. So 100% of the federal poverty level, that's what they classify. Anything below that is poor people. And they get that number by looking at groceries and saying, okay, how much does a family have to buy in terms of groceries for a month to be able to survive? And they're not looking at expensive groceries. They're looking at things like rice and beans and just maybe a little bit of meat, not much. Very subsistence level basket of food, some fruits and vegetables. And then they multiply that by 3 because they say a household should be spending 1/3 of its income on food. This measure was created literally in the 30s and 40s. And it hasn't really changed since, which is shocking. I mean, it keeps getting increased, every year a little bit for cost of living, but really it's a very bad measure, honestly. And they use this for determining eligibility for public programs. Actually, right now, the federal government is recognizing, I think that the academic community has done a very good job of saying that this is not the best measure to be using. And it's also the same measure in California as it is in Mississippi. It's the same across the entire 50 states. It's the same in San Bernardino County as it is in San Francisco County, which doesn't make any sense either. So right now, the federal government's changing that measure to make it reflect housing costs and transportation costs and child care costs and those other things. And healthcare costs are being included in there as well. And so soon we'll have a better measure. But right now, all we have is the federal poverty level. Now, 100% of the federal poverty level, we have 2.3 million uninsured living under that. And the poverty level is about $13,000 a year for one person. And it rises to about $17,000 for a household of 2 people, a little over $20,000 for 3 people. In Los Angeles County, trying to live on under $13,000 a year for one person is ridiculously hard. I'm not sure if anybody here has ever tried to do that, but I think that's even less than what the students make. Now, what amazes me is that there are 2.3 million uninsured people in this state who are living at that income level. So when you think about your own lifestyle and your own income and how difficult it is for yourself to make ends meet, in this economy, think about all of these people who are living at that. And then 100 to 200%, we have another 2 million people, another 30% of the uninsured living to that. So 200% of the federal poverty level would be $26,000 a year for one person. So you multiply it by 2. And then 2 to 300 is another 1 million. And then the relatively wealthy, uninsured, 1.5 million at 300% or above. So you can see the uninsured is a very low income population. These are not wealthy people saying, oh, we just don't want to spend our money on insurance. There are millions of uninsured who just can't afford a health insurance premium of $1,000 a month that you would get in the non-group market if you're lucky. Many of those premiums do go to that level. They can't afford even when their employers offer them a job. There are people who get employer insurance offered to them, and they're eligible for it, and they have to turn it down because they can't afford to have the extra $200 that their employer is requiring that they pay taken out of their paycheck every month or every 2 weeks. So this is a really important thing to keep in mind when we think about who the uninsured are. Yes?
I have a question. When we're talking about uninsured, are we talking about legal residents of the state, or are we talking about undocumented?
Well, this includes everybody. This does include everybody. And I don't have a slide on exactly the citizenship breakout of the uninsured here, but I will get to that in a minute in terms of eligibility for healthcare reform. But the undocumented are a very small proportion of the uninsured. The uninsured are overwhelmingly U.S.-born citizens, naturalized citizens, or legal permanent residents. We're going to get to that in just a second. But this does include everybody who's uninsured. And I do want to actually add on to that real quick that when I say uninsured, I'm talking about uninsured for all or part of the year. So in the current population survey, it was just you never had any insurance. When we look at it for the California Health Interview Survey, we look at people who are either uninsured all year or uninsured part year, where they lost their coverage and became uninsured, or they kind of cycled in and out of coverage. Those are included in there as well. Okay, so now let's get to immigration status. And this is from our new policy brief that just came out, and you can find it on our website, available for download. This is an exhibit directly from that policy brief where we just looked at children. And so this is ages 0 to 18, and here we're looking at, you can see it's family citizenship status. Because when you're talking about immigrant children, I mean, these two categories are very important. This is the non-citizen child who has a green card, legal permanent resident, and the non-citizen child with no green card, which is the closest we can get in our survey to undocumented, but our models have shown that that's very, very close, and it's closer than anybody else can get with their surveys. And then here we have the citizen child, though. These are both children U.S.-born, citizen or naturalized, but here they have non-citizen parents with a green card, and here they have non-citizen parents with no green card. And we do that because research has shown, not just ours, but also from others in the country, that a parent's insurance status and citizenship status impacts the children very strongly, because the parents sometimes have a hard time conceptualizing that their kids can be eligible for something that they're not. And also, this hasn't been as much of a problem lately, because I think California especially has done a very good job of kind of destigmatizing these things and delinking immigration, but it has been a problem in the past. They call it the chilling effect of this group of parents being very concerned that if they sign their children up for public coverage or try to get them insurance, something that is legal, then they're going to get turned into immigration status and have their immigration status impacted on that. But those two have been, delinked, and I think the advocacy community has done a very good job. The organizations who work with this population of educating people that that's not the case. And you can see here that 3/4 of them, actually their children do have public coverage. So they do sign their kids up for public coverage because this is a very low income population and their citizen children are eligible for it. This group also has 41% on public coverage and a higher rate of job-based coverage, and the uninsured is actually at the top there. So you can see here, the uninsured is 13%, and here it's 8%. So these two groups with citizen children are doing better than the non-citizen children who actually themselves may or may not be eligible. There's still 45% here on public coverage and only 25% with job-based, but the uninsured number starts to creep up to 21%. And then among kids who are themselves non-citizen with no green card, the uninsured rate's almost 50%. And then there is some public coverage here, and that could be because this might be picking up some children who are here under, they call them the PRU-call status, and under rules where they would be eligible for public coverage even though they don't have a green card. So there are some of those categories, but still an uninsured rate of almost 50% is pretty shocking. And remember, these are children, who have no control over their own citizenship status or not, and also who have healthcare needs. Children should be visiting a doctor. Children should be getting regular health care, especially preventive care in kids is so important. And over 50%, almost 50% are uninsured. Okay, so now let's talk about national health care reform and immigration. So let's take a big picture look at national health care reform. Again, we're going to stepping back to the national level here. And this chart is actually from the Congressional Budget Office, and these are their estimates of the PPACA impact, which everyone is now calling it the ACA, the Patient Protection and Affordable Care Act. Most people are calling it the ACA, so we're just going to call it the ACA all the way through. So these are the estimates the Congressional Budget Office put in their letter to Nancy Pelosi when she was Speaker, as their official estimate of the impact of what this would do. And this is a complicated chart, so I'm going to walk you through this. these two sections are separate. And then you combine them, and I combined them down here. So it goes from 2010 to 2019. And remember, they were writing this in early 2010 based on their own models. And they got the uninsured number at 50 million. Spot on with what the surveys came out with. So it's nice to see that their estimates came out. And so this top group right here is what happens to the insurance status if there is no ACA. Okay, so here's basically their estimates of the current system. And then if there's no ACA, if healthcare reform does not exist, this is what they think will happen by 2019. And you can see that they're saying that there's going to be about 35 million people in the Medicaid and the CHIP programs. And then here, their estimate is of the change, plus or minus. So if ACA is enacted, here's what happens in 2010. Not much, right? Because not much happened the first year. But then they look at what happens, the following years. And in 2014, when we start getting the major expansions in healthcare reform, 2014 is when the Medicaid expansion happens. And we'll talk about that in just a second. And then also the exchanges come into play. So here they're saying that by 2019, another 16 million people will be in Medicaid and SCHIP. So in 2019, if we do nothing, there'll be 54 million uninsured. And honestly, I'm thinking that's even a little low because the recession is going on. I'm kind of surprised that their estimate said it only grew to 54 million, but that was their estimate. And that if we have healthcare reform, 32 million people will stop being uninsured. That's why it's a negative. They move out of this category. And then also 24 million people gain coverage through the exchange. And then what I did is I put those numbers together to make it nice and easy for all of us to read. So we end up with 51 million people in Medicaid and CHIP, 158 million employer base, which is not too big of a change, and then 24 million in the exchanges, 25 million still kind of in that non-group market that's outside of the exchange, and 22 million still uninsured. So healthcare reform covers an additional 32 million people, but it doesn't cover everybody. So there are people left out. That's just in the basic estimates. And there's one big group left out, and that is people who decide that they are just going to not care about the individual mandate, assuming that the courts keep that in place, and pay the fine and just stay uninsured. So there is that group. They're assuming that some people will do that. But then the big group left out is all based on citizenship status. So now let's move to California, and I'll explain kind of what these eligibility rules are. So this is from a policy brief that we put out, which again, I forgot to mention actually is also in that same policy brief as our California 2009 health insurance status. And you can find this on our website. It's from February of this year. And here we can see the different breakdowns in terms of the major categories in healthcare reform as to what the uninsured are eligible for. This is that 7.1 million uninsured that we talked about before. So the Medicaid expansion, which in California again is Medi-Cal, is going to be a little bit over 3 million people. 3 million of the uninsured are going to be eligible for newly expanded Medicaid. So the way that they expanded Medicaid is they said for the first time that childless adults will be allowed into the program. That is a big change. So now if you're low income and you don't have children, depending on your household income, you might be eligible. You at least have a chance. And that income level was set for everybody, all age groups, all family statuses, at 133% of the federal poverty level. So that ends up being about $17,000, $18,000 a year for one person, and it goes up. So they made it a little bit more generous than it was before for adults, and include all childless adults, and include the children that were already included are going to stay included, and that ends up being 3 million people of the uninsured are going to be eligible for this Medi-Cal expansion. Now, not all of them are necessarily going to sign up, and there's statistical models going on that to see who actually will enroll, because it will take some effort on their part for them to enroll. But this is a huge change in California, and it's a really nice expansion for public health insurance. So that's 43%. That's the biggest group. So then we have the exchange. And what the exchange is going to be this new online marketplace, because studies have shown that everybody goes online these days. Honestly, even homeless people go online. They go use the libraries. So the exchange is going to be an online kind of regulated marketplace where people can go, and every state is going to have these. So every state is working on setting these up. And in California, people will be able to go to the exchange, fill out a form, And then that will determine whether or not they're eligible for Medi-Cal. So if they are, it'll put them in there. And if their household income is too much to be eligible for Medi-Cal, if they're between 133% and 400% of the federal poverty level, then they get some kind of subsidy to be able to buy health insurance through the exchange. And the health insurance is going to be highly regulated, and there's all these other rules, but the important part here is the federal government's going to help them out and be able to pay for part of that premium. So they're hoping that that market will grow because all of a sudden they're helping people buy something that before was too expensive for them to buy. So 400% of the federal poverty level is about $88,000 a year for a family of 4. So it's very much solid middle income, middle class families in California. And there are even calculators online if you want to go to, the Kaiser Family Foundation has a great one that you can go in and put in what your income is now and what your family is and all that, and it'll calculate what they think your subsidy might end up being. You know, I mean, we don't know yet because it's not operational yet, and it won't be until January 1st, 2014. But, you know, it's very possible if you're under $88,000 a year for a family of 4, around there, that if you wanted to buy your insurance through the exchange, you are going to get some kind of subsidy. And the subsidy is more for people who are down at the lower end of the income scale. So if you make $150,000 a year, they're going to pay for more of your health insurance than they would if you're near to the top. So there's this big group right here, 24%. Now here is another group, exchange eligible without subsidies. So these are people whose household income is over that 400%. So they're still going to be able to buy into the exchange. They just won't get much help doing so. And this is about 1.2 million people. And this group right here is the one that we're really concerned about today, which is 16% of the uninsured, about 1.1 million. It says not eligible due to citizenship status. Now the citizenship status exclusions are that if you are non-citizen without a green card, if you're undocumented, not only are you not eligible for Medi-Cal expansion, you can't get into Medicaid, which is also the case now, but you are also not eligible to even buy into the exchange with your own money. So you won't even be able to go onto the exchange website. There will be some kind of citizenship test to even purchase in the exchange, which reduces the pool, honestly. And the exchange is all about increasing the size of the pool. And this population, honestly, is younger and healthier than the rest of the uninsured population. And so if they wanted to go in and spend their own money, they would actually just be really subsidizing the older and sicker people, which makes all kind of good insurance financial sense. But because of the political situation, they're not even going to be allowed to buy into the exchange at all, which is, I think, you know, not necessarily the best policy choice in terms of we want to get the risk pool, you know, balanced in the exchange. And one thing I would like to point out here that we didn't talk about before is that in terms of adults' insurance status, who are immigrants themselves, this group is the people, you know, who are adults who are non-citizen without green card do have the highest rate of being uninsured. You can see that you saw the children were a little under 50%, the adults are over 50%. And there is some proportion that do have job-based coverage, but it's around 15%. It's very small. So this population really is an uninsured population, and they're likely to remain so after all of the health insurance gets enacted, all the health insurance reforms get enacted. One thing I would also want to point out about this group is that it's actually a smaller percentage than it was in 2007. So remember that I said that the uninsured population, that 7.1 million, it grew from 2007 to 2009 from 6.4 million to 7 million. But this population actually got a little smaller. The number got a little smaller. And this is consistent with every other survey that's out there that says that the undocumented population is actually getting smaller due to a combination of factors, due to the economy and also due to the fact that the immigration rules have become more strict and border enforcement has become better and over the last few years. And so this population is smaller than it used to be. And so it's an even smaller slice of the pie than it was before. Going back to that question earlier about how much of the uninsured are actually a non-citizen without green card. This is a smaller proportion. Okay, so now here is another table from our policy brief. And this is the one that was also included the exhibit about immigrant children and their health insurance status. This is looking at immigrant children by those different family statuses that we talked about before. and how they're impacted under ACA. So this is a complicated table, and let's just walk through it kind of step by step here, because I know looking at this table, it's not really immediately apparent what it's trying to tell you. So we're going to walk through piece by piece. So what we're looking at here is just children who are legal permanent residents, or who have that status in their families. This top part is the children who are legal permanent residents, and children who are non-citizens without green card, and those are the ones who are directly affected. So when you think about those 4 bars that we saw earlier, this group right here are in the last 2 bars, okay? And then this group, we call them indirectly affected because their parents are legal permanent residents or non-citizens without green cards. So these were the first 2 bars that we saw before. So when we look at the citizenship requirements in ACA, restricted from Medi-Cal enrollment, there is a requirement that is consistent with federal law in the ACA that says that if you're a legal permanent resident but have been here for less than 5 years, you can't get Medicaid. It won't be paid for by the federal government, at least. Now in California, we have actually paid for it out of state funds since that federal funding was taken away. So that really hasn't been an issue on a day-to-day basis here in California, but when you're looking at the federal reforms, it does appear in the federal reforms, and so it is something that we like to pay attention to. So here we have 10,000 children who are legal permanent residents who have been in the United States for less than 5 years. So they would be restricted from joining that expanded Medi-Cal. These are the expanded with the federal money. Now we don't know yet, honestly, whether or not the state is going to step up and say, we will keep covering that population with the expansion and we're going to pay for it. That's really unclear because right now the state is going through such a horrible budget crisis, and it has been for a very long time, that they keep looking to cut Medi-Cal in many different places. Right now there's actually a Supreme Court case being decided about whether or not California can make all the cuts it wanted, including cutting rates to providers, capping doctor's visits, the level of how many you can get per year, and also putting in co-pays that are unaffordable for low-income people. So there's really no guarantee that the state will be able to say, we're going to step up and cover these kids. So we wanted to highlight that this population existed. And then here we have the non-citizen without green card children. Directly, 140,000 of them are going to be excluded from the Medicaid expansion. And then here we have this 30,000 group that won't be allowed to get coverage in the exchange. And so here you can see that adds up to 180,000 children who are non-citizen without green cards themselves and are directly affected and excluded from the ACA expansions. Okay, so that's the first part. The second part is those children who are citizens, but their parents are non-citizens. And so we talk about them in terms of being, you can see here we say direct effect and excluded, and here we say indirect effect and potentially excluded, because we're basing this on the fact that there were still some uninsured in that population that we talked about before, but we didn't want to necessarily overestimate. So here we have this potential restriction from Medi-Cal enrollment at 10,000 because it was 50,000 children who are citizens and whose parents are non-citizen with a green card, without a green card, but there was still a proportion of them that were enrolled in that group. Remember, there was 3/4 of them enrolled in public coverage. So we only estimate that 1/4 of them will not be enrolled in the public coverage. So there will still be some population whose parents will not enroll them for the coverage that they're eligible for. And then restricted from the exchange, we have 30,000, and we put that at 100% of this group because honestly, the way the citizenship requirements are going to be for the exchange, where the parents have to fill out the forms and present their citizenship, we think that is really a very strong potential barrier to having non-citizen without green card parents be able to enroll their children at all. And whether or not there will be child-only policies available in the exchange is also still up in the air. We're not really sure. So this we set at 100% and said that 40% are going to be potentially excluded. And so then when you look at the total here, 180 plus 40, our total of 220,000 children will be impacted either directly or indirectly from the citizenship exclusions. Are there any questions about that? So hopefully we've walked through it, pretty clearly. But I do want to emphasize that what we're trying to do here is really highlight the populations that could be impacted And so what we're hoping to do is by doing this kind of this early in the process, that eventually these populations will be included in some way. And that's what we're trying to get to. So we're not saying, in 2014 this absolutely will happen. We're saying if nothing changes, this is what could happen. And what we would like to see is the legislative community address these issues. Okay, so that it's very clear that adults and children, there will still be some residual uninsured. Even if all of the U.S.-born citizen and naturalized citizen people who are eligible that we talked about sign up for health insurance, which is not likely, but even if that happens, then we have these citizenship exclusions, and there will some people be left uninsured. And so we wanted to look at where they get care at this point and what happens with the safety net. It's very important because the safety net, and Los Angeles County's safety net officials and leadership have been very concerned with this, is that they're concerned that this population here, this citizen child with citizen parents, who's 45% of them, this is among uninsured people, 45%, that's 45% of their population right now. And these people are likely to get insurance, and these people might get insurance, right, citizen child with legal citizen parents, and then they might not choose to be in the safety net anymore. That if they're the insured at that point, that they are going to then leave those safety net clinics and hospitals, and then the safety net will be left taking care of this significant population here of non-citizen without green card kids, these people who might still be uninsured and not have the resources to be able to do it because all the resources have been sucked out by losing the majority of their population. So I think there is a misconception out there that right now the safety net is being used only by the undocumented, and that's really not the case. And there is this danger that the safety net might find itself with a severe lack of funding if they aren't, given if all of the insured choose to go somewhere else. And that's also tied into the fact that another thing that the ACA does is it reduces the payments to the safety net that have been going on for years to cover, for care for the uninsured because of the assumption that people will get insurance. Okay, so let's just talk a little bit about what is happening with the ACA. Now, I'm not talking here much about the Supreme Court decisions because we're really not sure what's going to happen with that, and that might change everything. But this is just kind of putting that aside, whether or not the Supreme Court will overturn the entire law or just a part of it or not. This is what's going into play right now. So states are absolutely moving ahead with implementation. I know in the policy world there's a lot of discussion about stopping it, but in the political world, but in the policy world, the states are each moving forward ahead full steam. Here in California, we're even implementing that Medi-Cal expansion early. We got a federal waiver called our Section 115 waiver to be able to do this project called the LIP project, if you ever hear that acronym, LIP, Low Income Health Program. And that will expand Medi-Cal already now on a county-by-county basis to adults who are childless and who fit those income requirements. So we're starting early to do this, and these are really on our mind. But again, citizenship requirements apply to LIP as well as they do in the others, and so undocumented are left out of those expansions. So we also have an interesting situation in Vermont where they passed a single-payer bill, and they said, okay, what we're going to do is implement everything in 2014, but by 2017 we're going to have single-payer in Vermont. So that's just something to keep an eye on about what that will look like. Single-payer systems tend to be very inclusive in terms of citizenship requirements. As people who have traveled to other countries that have single-payer systems, just being a traveler in that country, you can still get health care. They don't exclude based on residency or citizenship and all that in the same way, usually. Not 100%, but usually. And so it's usually just says if you are here, then you get care. So whether or not Vermont will implement something like that, I think will have a big impact here about whether or not this country moves towards saying anybody who's here can at least buy into the system, and be able to participate in this. The exchanges are all being implemented. They, across the board, states have the choice to either accept money from the federal government to set up their own exchange and to create a state-based exchange, which the majority of states are doing, or they can actually refuse federal money to do that, and then the federal government will just set one up for them. So this is happening. An interesting tension here in terms of that implementation is that there was a batch of Republican governors, which did not include Arnold Schwarzenegger, I'd like to add. When Schwarzenegger was governor of California, he was the one who signed the legislation very quickly, and California was the first state to establish our exchange legislatively, and he really pushed for that on the basis of California should be able to get all the federal money it possibly can, and let's do this early, and let's create this marketplace. You know, that's the whole point, is creating a marketplace for consumers. There are other Republican governors across the country, though, who said, no, we don't want the federal government's money to do this, forget it. They're facing opposition from their Republican legislators who are saying, wait a second, we want the money to set up our own. We don't want the federal government to set it up for us. So that's an interesting tension, and many of those states that are having that tension right now are states with high immigration levels. So that's something to keep an eye on as to who sets up a federal government exchange and who does their own state-based exchange. The delivery system reforms in the ACA are also being implemented, and those are happening even a little earlier than the insurance expansion reforms, because those are happening with payments from the Medicare and Medicaid programs to do these pilot programs. ACOs, for those of you who don't know, is accountable care organizations. ACO is the new version of HMO, but they're absolutely not the same. They're a little bit the same, but ACOs are kind of the updated version, and they're talking about global payment systems to be able to integrate, across systems instead of just having. But it's not the same as capitated for patients. But this will hopefully bring costs down in terms of care for everyone, and also these quality of care reforms. And what's really interesting here is that all these things are happening all at once, right? So we have the insurance exchanges and all these things happening in terms of insurance expansions happening, the quality of care reforms and the cost drivers. They're trying to do that all at the same time. So there's an awful lot going on. And these things might still impact care, health care, for immigrant populations. Because even the Los Angeles County safety net system is talking about how they want to move more towards an ACO system and being an integrated system, and they want to increase quality of care in terms of patient satisfaction. I mean, they're talking about patient satisfaction in a county health system now. So those things might actually still improve health care for immigrant populations, even if they do still remain uninsured. And then something to note about if Republicans do win the White House in 2012, an actual repeal of ACA is very unlikely. Because to do that, they would also have to win both chambers of Congress. And it's just looking unlikely statistically. They'll probably keep the House, and they probably won't take over the Senate. But there could still be, even with a Democratic Senate, a Republican in the White House could make it very difficult to implement ACA. That is absolutely possible. And the current Department of Health and Human Services is working overtime to put out regulations about, we're implementing this, we're implementing that, and here's what we say about this, and here's what you have to do. But if you have a Republican in the White House, they could just order HHS to not do that anymore. And if there's no regulations on it and no way to actually implement things like, well, how do we pay people for ACOs or quality of care reforms, then it just doesn't get done. Another possible thing that a Republican president could do is, just like George Bush did with the CHIP program, back when it was still the S-CHIP program, he tried to issue an executive order that said that you are not allowed to enroll people who are higher income, so over 200% of the federal poverty level, up to whatever level your state is, in the S-CHIP program until you can prove to us that you've enrolled 85% of the eligibles below that. That is a very difficult thing to prove. Very difficult. Most states do not have a California Health Interview Survey, because what you need there for a numerator is how many people are enrolled, but that denominator of, well, how many people are uninsured but eligible for the program, very, very difficult to calculate. With our CHIS survey, we can do it, and the state turned to us to try and calculate that. Most states don't have a survey like this, and so just even coming up with that number was something that was impossible. And actually, what ended up happening here was that a group of states, including California, under Schwarzenegger, threatened to sue and said, this regulation makes the law unable to be implemented, and so we'll sue you in the Supreme Court if this goes through. And the Bush administration actually backed down from that. But considering the passion around this issue, especially on the Republican debates, and how there have been so much talk about repeal or blocking parts of ACA. I do think that this should be kept in mind as something that could happen that, and with the immigrant population specifically, I think are very susceptible to saying whether or not they could be subject to this kind of regulation. So something to keep in mind. So thank you very much. I appreciate your time. Here's my contact information. A lot of what I do is assisting the public, helping the public with data, any kind of health insurance questions. So please feel free to contact me, and I appreciate your time.